Welcome to Glass Half Full with Leslie Krongold. She shares her stories, experiences, and knowledge of living and coping with a chronic health condition. Learn about tools and resources and hear inspirational interviews that help you to live a life filled with quality and dignity. With 2 decades of support group leadership, Leslie's ready to help you make lemonade out of life's lemons. Are you ready?
Hello. I hope you're all doing well and finding ways to feel engaged during our continuing shelter in place. If you listened to our last podcast episode, you heard me rave about the online exercise classes I've been taking. I'm doing other activities as well, which are safe. No beach parties yet. I've been working on a list of 50 ways to cope with COVID-19. It will be available only to our newsletter subscribers, so go ahead and subscribe to the newsletter on the Glass Half Full website. Today's episode was not inspired by the pandemic, but it does take on a whole new meaning now. It's not a sexy topic, but it's important. Dental health. I've never been a huge fan of going to the dentist, but getting a cleaning twice a year is hardwired into my positive health behaviors. I've always disliked the x-rays the most. Well, I was not fond of the fluoride treatments either as a kid, but it must have paid off because I've been fortunate. I've had maybe 2 cavities in my life, and I know nothing of the experience of root canals and any of the other dental procedures. I had been quite loyal to a dentist I discovered a number of years ago. She received great reviews for her practice, and everyone there was quite pleasant. I had to stop going to her a few years ago because her office was no longer accessible. There was a steep flight of stairs to get to the clinic and no elevator in the building. I delayed my transition for a while, but I dreaded those stairs, and I became a little resentful that there was nothing anyone could do. I wasn't going to be carried up, and the practice didn't seem to want to install any type of lift. So I found the dentist you'll meet in a few minutes. I only need to deal with about 3 steps up to her office that I can handle. But there are other obstacles I experience in a dental office. I feel uncomfortable being in the horizontal position, so the hygienist works with me to find the best angle of recline that works for both of us. She also gives me control of that handheld suction device, which eliminates both my anxiety and discomfort. So far, x-rays are still one of those necessary evils, but with some breath work, I can get through it. A few years ago, when I started having these issues, I thought about my patient cohort and others with neuromuscular disease or disability. I was working for a patient advocacy organization at the time and suggested to the director we find a dentist to speak about modifications that could help us, during our dental clinic visit. They found a speaker, an old, and I mean old world, dentist who I spoke with before the conference. I was helping him, with his presentation. I told him about my difficulties and the particularities of having myotonic dystrophy, because he wasn't familiar with the disease. Unfortunately, it's often difficult to get the presentation slides in advance from a physician. If I were in charge, and I haven't been, I would vet everyone. But this man came to speak to us without anyone seeing his presentation, and he spoke to us about children and adults with developmental conditions. Very little of what he spoke about was relevant to us. The following year, Those in charge found a hygienist who spoke with more compassion and a little more relevance, but she was still off the mark. I have found a few helpful documents on the internet. One is called Creating Disability-Friendly Dental Practices from the Independence Center. This report discusses specific dental issues for people with anxiety, autism, blindness or low vision, deaf and hard of hearing, mobility challenges, chemical sensitivities, and PTSD. Another downloadable file is focused on oral health for people with Parkinson's disease. And the final article that you can get off the Glass Half Full website is from the Brain and Life magazine. It's an article titled Dental Visits Made Easier, and yours truly is quoted. That's me. Given all of these potential hurdles, now we're faced with COVID-19. I was scheduled for a routine dental cleaning, and I decided to postpone. I wondered how other people were handling this, so I posted a poll in our Facebook group. The response wasn't huge. I guess not everyone loves poll taking like I do. But out of 9 responses, only one person hadn't canceled or postponed a dental appointment. So my concern is part of a majority. Now you know the gist of what I wanted to cover in my interview with a dentist. My dentist, Helena Caballero, has been practicing dentistry for 25 years. She is originally from Los Angeles, but she and her practice are now in Northern California, not far from where I live. The 3 areas we spoke about are oral health and hygiene, how COVID-19 has changed dentistry, and modifications for people with disabilities. What would you say are the best ways to maintain or achieve good dental health?
Well, that's a very good question. I would say common sense is always the rule. And I always speak to my patients about this. The best ways to achieve dental health, good dental health, is number 1 is toothbrushing. So that's super, super important. Flossing, people don't like to do that, but it's absolutely one of the best ways to prevent cavities. And also rinsing with an antimicrobial rinse. That is good to do once or twice a day. And of course, we want to top that all off with seeing a dentist regularly. That is very recommended. There are other things too as well. We want to definitely say nutrition is absolutely essential, for a good oral health and your general health as well. So you want to eat healthy and limit your sugars and your starches and keep in check your alcohol, and definitely want to quit smoking if you're smoking tobacco. Want to limit some hard foods, and acidic foods and drinks are also very detrimental to your teeth. So those are pretty much the nuts and bolts of good oral hygiene.
So when you say hard food, what do you mean exactly?
Well, we're seeing a lot of issues with eating nuts, especially hard nuts like almonds and things. They tend to crack teeth and put a lot of pressure on already weak teeth or teeth that have had a lot of dental restorations on them.
So nature versus nurture. Is there any agreement on how much of your dental health, your oral health, is genetics or lifestyle behaviors?
Yeah, that's a really good question. We are kind of going back and forth on that, but I would think the consensus now is that nurture is much more important. And so that means maintenance. And so that just comes back around to the oral hygiene of person, is to the more maintenance that you can do, the better your overall dental health is going to be, and your general well-being as well. As far as keeping teeth for a lifetime and why is it so important is because dental problems, occur, with a lack of, hygiene. Some people think the lack of pain is an indicator of good health. They don't have pain. They don't want to see the dentist, those kinds of things. Like other health issues like diabetes and heart disease, those are also not, pain related, and they can cause some huge issues. So I would just say you want to keep your teeth for a lifetime and avoid expensive dental work and emergencies, and you got to work on the maintenance for sure.
I think we tend to compartmentalize oral health and hygiene as separate, right? We don't really have this holistic approach. And I think part of that is because, dentistry is set aside from all other health care.
Right.
Is there a reason why dentists and dentistry is a separate entity from
Yeah.
hospitals and, all the specialists that exist?
Mm-hmm. Yeah. Actually, when dentistry emerged as a profession in its early days, it wasn't really connected with, the medical aspect of health care, and we did the early dentists did push to be included in the medical realm as far as medical issues and the whole medical model, and I think just early on there was just a disconnect between physicians and dentists, and they just kind of didn't come to terms with those two areas, and so we just made a break away from the medical realm and went off on our own. And I think there is some problems even today with connecting the two and to having a cohesive, relationship, which sometimes can be problematic because our medical personnel sometimes doesn't understand what we're trying to do, and sometimes there's a disconnect, unfortunately.
So we're going through a rough time now. COVID-19, I'm sure, has impacted dentists and dental clinics and, how you conduct your routines and practice. So I'm interested in hearing about, how you're impacted. What have you seen in these past 4 months?
Yes, we've definitely been impacted. We've obviously had to shut down our practice with the exception of emergency patients. And we definitely want to do that in order to keep people safe, keep us safe, and obviously implement the things that we needed to do. In our practice, it's basically been a fluid scenario. We are back full time, and we have been back for about 2 weeks with a lot more precautions in place. And this is all CDC guidelines that we've implemented. We have always had a very clean practice, as many dentists have. We have standard precautions in place. Those kinds of things were done during the AIDS crisis, where we're, obviously wearing gloves and masks and, additional equipment that we place on ourselves. And we've always been ready for these kinds of things. So I think dentists are well prepared in the ability to maintain very high infection control standards for this kind of scenario and for other emerging diseases. So we are well stocked with our PPEs. We have put in place some other things to help maintain the flow of patients, an air purifier and things like that. So yeah, it's difficult right now, and a lot of people are hurting, and job loss and things like that. But we've felt that in our practice, many people have come back. There have been just a few that are waiting, and for the most part, everyone is very, very good about wearing their masks and coming in and really wanting to come back for cleanings and maintenance and getting their dental work done. So I think that's very good. It's a very good sign.
Is it a law now that the CDC has put out that all dental clinics have to follow, whatever the new guidelines are?
I wouldn't say it's a law, that's strict. It's more like a highly recommended guidelines. And there are many agencies out there with guidelines, but the CDC is really what most dentists are referring to at this present time. I mean, we do have the American Dental Association, the California Dental Association, OSHA, and all these other agencies that provide guidelines as far as disease prevention and control, those kinds of things. The CDC has, more extensive precautions, I would say. So that's kind of what we're adhering to at this time.
So if someone who's living in, I don't know, Nebraska, and they're due for a regular cleaning and they're concerned because they are part of, a high risk group, is there anything you can recommend on how they can confirm that their dentist is doing the utmost?
Sure. Call their dentist and ask them what kind of precautions they have in place. How are they situated to help? And I would say, what we do and what I would say most other dentists do is we treat everyone the same. We have to treat everyone as though they could potentially have a condition, and that is how you prevent other problems from happening. We basically have a tiered approach as to how we screen our patients before they even come into the office. If anyone's showing any signs of being ill or those kinds of things, then we just reappoint them at another time until such time they feel better. All those things happen before they even come in. So we are then working with the population that we believe is safe, and then we treat them all the same. So, with people that have disabilities and things like that, yeah, we do ask them a few more questions about what is their disability and how we can help them in terms of the dental procedure, the time that we spend with them, or maybe a caregiver coming in with them and explaining things to them where they understand, and also instructions for the caregiver in terms of keeping particular patient's mouth clean and so on. So those are the kinds of things that I would say most dentists do to keep everyone safe.
Mm-hmm. In terms of brushing and flossing, what is available for people who have trouble with that because of maybe manual dexterity or not able to, keep their mouth open wide enough, to do the
Right.
flossing themselves?
Sure. I would say that the things that we can help with flossing are things that twist the floss around a plastic, like a Y flosser. Those are great for people that have dexterity problems. There are also other available aids for flossing under bridges and little tiny brushes that are called proxy brushes. Those are meant for in between your teeth. There's so many different kinds of available aids now to help with those kinds of things. And just with people that have orthodontic braces on, those are really great things to have handy. So unfortunately, there aren't too many excuses now to not floss with all those available tools that we have at our disposal. So, just go and find things and try them out. And sometimes your dentist will have those kinds of tools available to look at and to try out.
Health conditions that are associated with dental problems, which I would imagine could be, you have dental problems and you leave them untreated and then it affects other parts of your body, or you have some health condition that left untreated can have an impact on your oral health. Can you speak to that?
Yeah, there is some of that. I would say it's more kind of the opposite, where dental problems could cause health problems, not really health problems causing dental problems. Untreated dental decay, not having a filling done or not having dental work done or having your teeth cleaned and things like that, and waiting for things to get bad, like emergencies, pain, things like that's a big issue. That obviously gives you lots of problems. You could have an abscess, which is an infection, that could spread to other parts of your body, to your brain even. I mean, there are instances of people having brain abscesses, and obviously not good. It is very rare, but it does happen. Periodontal disease, which is gum disease, that is, for the most part, doesn't cause any pain at all until it's in its advanced stages. And by that time, you're going to have some tooth loss, and then you're going to have other issues. You may have, osteoporosis because of the bone loss that you have in your mouth. Dental problems do affect things like existing problems with diabetes and cardiovascular disease, heart disease. They're even finding links with dementia and Alzheimer's. It seems like every week we're finding new associations with problems with your health related to dental bacteria.
Can you just speak to different modifications that you or your hygienist have been able to make to help people with, any kind of neurological conditions or anxiety or developmental issues?
Sure. So, as I mentioned before, we do treat everyone the same, but in those kinds of cases where we know that someone has a bit more difficulty and needs extra help with either the time allotment or other issues, we basically find out as much as we can about their particular disability, and we prepare ourselves ahead of time to modify our schedule or spend extra time explaining things, asking them to let us know what they need, or the caregiver letting us know what they need. All those things come into play as far as how we treat those patients. Basically letting them know about the dry mouth conditions that many of them have, their inability to open their mouths. We have certain things that we use. Sometimes we just don't use certain instruments that we normally use on other patients, as far as because they require their mouth to be open longer. Those are the kinds of things that we do to help. Unfortunately, there are some that just we can't see because of the advanced conditions they have, or the need for more modifications that we can't provide, and those we generally will just be able to screen them on the phone and then refer them to appropriate practitioners.
So there are practitioners that are set up really to deal with certain conditions? I mean, how do you know them? Just from meeting colleagues and being in the...
Yeah, there are basically some type of dentists that do like mobile practices that'll go to your home if you have mobility issues and can't get around, or the dental chairs are too difficult for someone to get into, or they have wheelchair access kind of things. So, and that's a great thing to have. They really help with that kind of population where a lot of us can't see those kind of patients, or we can't modify our practices to that extent to help them.
I had no idea there were mobile dentists. That's really fascinating.
Yeah.
Huh.
There aren't too many of them, really. I mean, I could only think of one of them in the Bay Area that does this on a large scale. They have big mobile vans that go from place to place, that they go and see patients like this.
But hey, that's good to know. Nobody has ever mentioned a mobile dentist, and maybe it is because there aren't that many of them.
There are a few things we talked about that I'll leave you with. Dr. Caballero stressed that flossing is quite important, even if it's only a few times each week. It helps you avoid cavities and gum disease. Although unwaxed floss does a better job of removing bacteria between your teeth, she said waxed floss is easier to use. I asked about natural toothpaste versus the more commercially known brands, and she suggests checking to see if the toothpaste has fluoride in it
and has earned the seal of approval from the ADA, American Dental Association. That seal verifies the toothpaste's safety and effectiveness. On a final note, it is disheartening to know that Medicare does not really cover dental services. I've included a few links about this on the website, but there are Medicare Advantage Plus plans offered by some providers. I'm only learning about this now. If you or someone out there who has a better understanding of all of this, please feel free to comment on the Glass Half Full website in the podcast notes for this episode or on our Facebook page. So keep flossing, keep brushing, and keep washing your hands and wearing your mask. Take care.
Thank you for listening to Glass Half Full. Leslie invites you to leave a rating and review on iTunes. This helps spread the word to others dealing with chronic health issues. For show notes, updates, and more, visit the website glasshalffull.online. glasshalffull.online.